And as Singapore transitions to living with COVID-19, infectious diseases experts here questioning the need for the continued widespread enforcement of trace-together and safe entry rules. Noting that the vast majority of the population is fully vaccinated and most will show mild or no symptoms, they say that extensive contact tracing, as was done in the early days of the pandemic, is no longer practical or necessary. Associate Professor Alex Cook, Vice Dean of Research at the Swee Hock School of Public Health, joins me now. Hello, welcome back to The Big Story, Prof. So, if safe entry and trace together are done away with in general settings like malls, then what form would contact tracing take?
Well, early in the pandemic, we were doing thorough contact tracing because we wanted to find anyone who was potentially infected and quarantine them so they don't infect others. And that was back when quarantine was 2 weeks and it was monitored carefully by the authorities. We did this back then because we were trying to keep cases down until we're able to vaccinate the whole population. And our contact tracing last time was very successful, in part because safe entry and trace together let us identify people and places that had cases come into contact with or had visited. But we're no longer desperately trying to buy time. And it doesn't really seem tenable to quarantine people for 2 weeks like we used to, especially for vaccinated people who are at low risk of illness. So if we still need officers to be identifying close contacts, then yes, trace together is an efficient way to do that. But presumably, most people know already if their close contacts test positive. So once we completely delegate responsibility to individuals to self-quarantine, then we probably don't need trace together anymore. For safe entry, it seems to me that at the moment, the main value of that is that it is able to demonstrate if you're vaccinated or not, i.e. it's to implement the current vaccine differentiated entry measures. Maybe potentially to identify locations for sanitation or cleaning. Once vaccination is no longer required for entry into malls and shopping centres and restaurants and so on, then perhaps safe entry can also be gradually phased out.
Well, Prof, speaking largely about, just the contact tracing process, as we transition to an endemic state, is contact tracing even needed?
I'm not convinced it is. We don't do contact tracing for influenza, for example. Instead, we restrict it to more serious illnesses like active tuberculosis or HIV infection, where the scope of contact tracing is in a way narrower because you're doing it on a much smaller set of individuals, and also because we're actively intervening with those infections because we're going to be testing or giving out treatment if someone is infected. So for COVID, what are we trying to do by finding contacts either now or in the future? If we're not taking action, then what actually is the point of contact tracing? I think that it's probably only going to be in certain settings like hospitals or maybe nursing homes that there will still be some value to doing that contact tracing to find the cases so that you can intervene early with them or isolate them from subsequent individuals who might get infected. But that may not be with trace together or safe entry, since the setting in a hospital or nursing home is a bit different from out in the general population. It could be that other technologies like RFID, for example, may be more appropriate in that sense. Nevertheless, the technologies, trace together and safe entry, they do need to be kept ready for future outbreaks of new variants of coronavirus or disease X, because the two technologies have actually been extremely useful components of our early contact tracing successes.